Thank you for joining us for this special edition of KPBS News. I'm Maya Trabulsi. For the past few months, we've seen sky-high case levels and deaths in San Diego caused by COVID-19. But lately, the numbers have been trending down, which is welcomed news for our hospitals. This graphic provided by the county shows the trend and where we are this week. A couple of days saw less than 1,000 new cases, a level we haven't seen in months. The county reports more than 100 local deaths this week, which health experts say is a lagging indicator. And the dominant story this week is the expanded rollout of vaccines. Those 65 and older can now get their shot, and the county is making moves to meet people where they are. KPBS reporter Matt Hoffman was all over the county this week. Here are his stories from La Mesa to Julian.
We're 72 years old. We've been at home for a year and haven't been able to do anything. We're ready to get out and get it done.
The vaccination superstation in the East County is officially here.
We made it.
I know, you got it.
And San Diegans are ready for it.
I'm locked in. I mean, you can't do anything. I retired back in April. Haven't been able to do anything. If I want to do anything, I got to travel out of town, but I don't want to travel.
This Grossmont Center site in La Mesa is being run by Sharp Healthcare with support from the county. Right now, officials are doing about 2,000 vaccinations per day, and then they hope to scale up to 5,000. Here at Grossmont Center, the line is moving really quickly. People spending just a few minutes waiting to get their vaccinations.
It's almost a bit of a race through there, but we want to keep people moving nice and safe.
Sharp Grossmont Hospital CEO Scott Evans says this is their second vaccination site located inside of a shopping mall.
It's a wide sort of open space in a store that is no longer open, and so the area is good with good circulation. Malls have good parking.
Some people we talked to did have some trouble booking appointments through the county's website.
It was a little strenuous. I'm normally with Kaiser, and they're behind.
Right now, vaccinations at county-sponsored sites are limited for those 65 and over plus healthcare workers. People then have to come back in 3 weeks for the second dose.
I'm here to bring my parents to the vaccinations.
Sergio Rodriguez from Jamul was able to get both of his parents' appointments today.
They are 80 years old. And I was thinking, well, God let him live 3, 5, 10 more years. I want to be healthy.
The entire process inside takes just a few minutes. After vaccinations are given, people are observed for a short time inside the mall's food court.
Ya me vacuné.
I got vaccinated.
Gracias a Dios.
Thank God.
Sharp officials estimate around half of the vaccinators here are volunteers, like Kathy Gross, who is a retired family nurse practitioner.
When this opportunity came up, I was on it. And I just believe that we just need to get everybody vaccinated as quick as possible.
15 minutes, anywhere up there.
If you're interested in volunteering, officials are not just looking for vaccinators, but also others to help check people in and keep the process moving.
It just feels so good to be able to come back and help my community.
Appointments must be booked ahead of time through the county's website. This location will be open Monday through Friday. Matt Hoffman, KPBS News.
Way to go, Mom.
I know.
That's it.
Didn't even hurt. Yeah, we were wondering when they came, oh my God, we're going to have lines wrapped around the building. Nothing. Lovely.
80-year-old Tara Parker was able to get vaccinated today in Julian, not by a nurse, but by a firefighter paramedic.
You'll wait there for 15 minutes just to make sure you don't have any reactions to the vaccination, and then you'll sign up for your booster shot.
CAL FIRE San Diego and more than 20 local fire agencies are running Operation Collaboration. Instead of fighting fires on the front lines, these crews are delivering vaccines in rural areas and nursing homes.
You can see it's a large operation with several cooperators involved, not just CAL FIRE San Diego, but other agencies such as Carlsbad, Lakeside, Santee. We have members of the CERT team, which is a volunteer team of people that help protect the community and help us in times of need.
Little poke, okay? 1, 2, 3. Good job. No, that's nothing. And that's it.
Backcountry residents are grateful that officials are bringing vaccinations directly to them.
I have friends in Los Angeles who are struggling to find appointments, and it was so easy here, I thought, oh, I should tell them to drive 3 hours.
It was the first available site that I could get. I tried Borrego for a couple of days after we tried San Marcos and Carlsbad and all those places.
You do need an appointment to get a vaccination at one of these CAL FIRE sites. Crews will be in Jamul later this week and in Ramona over the weekend.
I'm going to set your appointment for the next vaccination.
County officials say between these mobile sites, superstations, and smaller vaccination pods, they can deliver 20,000 doses per day. But right now, they're doing half of that.
The problem that we have now is our efforts have far outpaced the supply of vaccines.
A little more than 500,000 total doses have been shipped to San Diego, but the county's dashboard shows just 2% of San Diegans have gotten both doses.
We still have a long way to go to get our 65 and older population vaccinated. It is important that they do because this age group has been one of the most vulnerable and impacted by this virus.
Would you like a Band-Aid on there?
Appointments at county sites are still available for people 65 and over and healthcare workers. CAL FIRE officials say Operation Collaboration has already delivered more than 7,000 doses to San Diegans. Matt Hoffman, KPBS News.
If you want to know just how much progress we're making on vaccinations, you can go to the vaccination dashboard at kpbs.org. It shows the number of local vaccinations compared to the total population. You can also find a list of vaccination centers. To see the tracker, go to the Tracking COVID-19 section at kpbs.org and then click on Vaccines. Developing a vaccine was a scientific challenge. Distributing it is a logistical one. KPBS health reporter Taryn Mento tells us about the local tool that state officials are looking at when deciding how much of the vaccine to give communities like San Diego.
The long lines at Petco Park may be frustrating, but a steady stream of idle arms makes for a higher burn rate. That's the window between receiving and administering COVID-19 vaccine doses. UCSD Health CEO Patty Mason says the state wants vaccinators to keep that short.
That we're able to administer the vaccine, within a week's time from, getting an allocation to in arms, and then that'll drive further allocation to us as a region.
UCSD Health's allocations go to its own patients and healthcare workers, and it administers the county's vaccines at the downtown super site. Mason says the burn rates for both are about 6 to 7 days. But the key to proving that to the state is the San Diego immunization registry.
So what it is a computer database of immunizations that have been given to people, regardless of which healthcare provider gave those immunizations.
UCSD's Dr. Mark Sawyer says the San Diego Immunization Registry, or SDIR, launched decades ago and is one of the few that's locally managed in California, which has a statewide registry.
It is a way for healthcare providers and pharmacists and schools to look up whether you're up to date on vaccination and get you caught up if you're not up to date.
County officials previously told KPBS SDIR was mostly used for childhood vaccinations, but now it's mandated for all COVID-19 shots. UCSD's Mason says entering information quickly is crucial.
It is the visibility that the state has for what we've talked about, the burn rate.
But Mason says burning through vaccines quickly is still a gamble. UCSD is setting up a mass vaccination site on its own campus that would likely serve the public as well as its patients. But she's unsure if or when the 3,000 doses UCSD gets each week will increase.
That said, we're never going to get allocation if we don't have the infrastructure to put it in arms.
San Diego County set a goal to fully vaccinate 1.8 million residents by July. So far, the county says just over 53,500 San Diegans received both doses of a COVID-19 vaccine. But it notes data may be missing because of reporting delays. Taryn Mento, KPBS News.
Our health reporter Taryn Mento also took part in a special panel discussion on the rollout of COVID-19 vaccines in San Diego. She was joined by local health industry leaders for a wide-ranging discussion on the science and the distribution. We have it posted for you on the KPBS YouTube channel. There's a small group of Americans using the vaccine as a money-making scheme driven by fear and misinformation. Antivaxxers are nothing new, but their tactics are changing. Drew Griffin shows us how they are attaching their message to extreme politics, including those who took part in last month's attack on the U.S. Capitol.
Thank you all for being here. This is incredible.
On January 6th, on a separate stage, yet very much part of the election protest, this micro rally had a different focus. These are the anti-vaxxers.
The forced COVID vaccine, such a scam.
Innocent people are being lined up
walking to their potential death.
Their event, part pandemic denial, part Stop the Steal, part prayer service for those who were participating in the Capitol storm.
We pray for the patriots that are there now, inside. They're trying to get inside that Capitol. Lord, use these people to eradicate this evil, these swamp creatures, this cesspool of filth and waste.
A CNN review finds the people involved in this micro rally are linking the anti-government Stop the Steal messaging to their anti-vaccine alternative health industry.
Roger Stone.
Some are directly connected to the disinformation network of Roger Stone. They name drop Stop the Steal organizer Ali Alexander and are peddling the same type of conspiracy-linked health products as Alex Jones, essentially turning conspiracy into business.
This is war between good and evil.
Anti-vaccine advocate Charlene Bollinger, who planned the rally along with her husband Ty, introduced speaker after speaker, stopping occasionally to gleefully report what was happening in the Capitol about a block away. Her husband left the rally to join in.
I asked him, are you at the Capitol? He said, outside it. The Capitol has been stormed by patriots. We're here for this reason. We are winning.
Also speaking, Mickey Willis, whose discredited video Plandemic was viewed millions of times before being removed from YouTube.
This is psychological warfare.
Invited to speak, Dr. Simone Gold, the anti-vaxxer who seeks donations to push her conspiracies. She became infamous with a stunt news conference at the Supreme Court last summer, appearing with other doctors, including one who's claimed alien DNA is being put in medicine. This is what Gold said at a MAGA rally January 5th.
If you don't want to take an experimental biological agent deceptively named a vaccine, you must not allow yourself to be coerced.
The next day, Gold went inside the Capitol and was later arrested. Through her organization, Gold tells CNN she didn't participate in any violence or vandalism and rebuked such activity. Conspiracism is the special sauce that links them all together, according to extremism expert Imran Ahmed, who co-wrote a study about the anti-vax movement and says making money is at the heart of it all.
These are snake oil salesmen. They're the oldest kind of liar and seller of deceit, of misinformation.
And let's just be very clear. For the money, for the profit.
Well, snake oil salesmen need to turn a profit.
That is apparent in the politics and business empire of rally organizers Ty and Charlene Bollinger.
Hello again, it's Ty and Charlene.
They have their own political action committee and run two businesses centered on conspiracies about cancer and vaccines. Their social media pages altogether have more than 1 million followers.
Have you all heard about the truth about cancer or the truth about vaccines? Yes.
The Bollingers live on 13 acres in this 7,600 square foot, $1.5 million mansion in rural Tennessee, once featured on a realtor website. Their cancer and vaccine websites are businesses, marketing their video series that cost up to $500, an air purifier that's more than $300, body cleanses, and other unproven health products. Disclaimers warn nothing presented is intended to diagnose, treat, cure, or prevent any disease, and anything purchased through their sites mean the Bollingers will be paid in some way. While they're not camera shy,
This is Frankenscience. We've got to stop it.
the Bollingers did not respond to multiple requests for comment from CNN. Drew Griffin, CNN, Atlanta.
All you need to do is click the link.
Money is a growing concern for the city of San Diego. The financial hole caused by the pandemic is growing, and budget cuts could come sooner than expected. KPBS Metro reporter Andrew Bowen explains.
The months-long surge in coronavirus infections and the resulting stay-at-home order led to a massive shortfall in San Diego's hotel tax revenues. A report released this week says the city will have to find more than $85 million in savings over the next 5 months, or dip into its reserves. Councilmember Sean Elo Rivera said Tuesday any cuts should take into account which neighborhoods are suffering the most.
Because the reality is that the impact of a reduction of a library or park and rec hours is simply not the same for a neighborhood where the average family can afford tutors or enrichment programs as it is for a family that is barely getting by.
In preparation for the next budget year, which starts July 1st, Mayor Todd Gloria has asked department heads to come up with cuts of between 2 and 8%. But the biggest variable in the budget puzzle is Washington. If President Joe Biden wins approval for his coronavirus relief package, cuts to things like libraries, parks, and road repair would be far less severe. Andrew Bowen, KPBS News.
The state's response to COVID-19 is driving San Diego's former mayor to dive back into politics. Kevin Faulconer says he can do a better job than Governor Gavin Newsom. KPBS reporter John Carroll says money is already flowing into Faulconer's campaign.
We can clean up California, and it starts at the top.
The Faulconer campaign released this slick 2.5-minute campaign video.
I'm Kevin Faulconer. I'm running for governor for the great state of California.
Faulconer held a rally to personally announce his run. By the sign behind him, you might think it was at a school named Cabrillo in San Diego. But instead, he made it in suburban Los Angeles, in San Pedro. We reached out to the Faulconer campaign to ask why, but no one responded.
It gives the Republicans really their best shot in the increasingly blue state of California.
UC San Diego political science professor Thad Kauser says the effort, begun last June to recall Gavin Newsom, may very well get the more than 1.5 million valid signatures it must have by the March 17th deadline.
It looks like it has the professionalization and the institutional support to potentially get there, setting us up for a fall recall.
Faulconer accuses Newsom of mishandling the response to the COVID pandemic, and missteps like dining at the exclusive French Laundry restaurant last November certainly haven't helped. But Faulconer is sure to have Republican company in his effort to oust Newsom, whether in a recall this fall or in next year's election. Rancho Santa Fe resident John Cox, who ran against Newsom in 2018, says he'll run against him again, and though Faulconer's campaign has already raised more than $1 million in the last 3 weeks, Kauser says it'll take more, a lot more than that, to seriously compete.
Kevin Faulconer is going to need $30, $50, $60 million to get a message out there that is different than just the Republican brand.
Some aspects of Faulconer's record from San Diego will surely prove a challenge, like the purchase of the asbestos-laden high-rise in downtown San Diego, and throwing his support behind a years-long effort to expand the convention center. Here's what former Convention Center Corporation Chairman Gil Cabrera told Metro reporter Andrew Bowen about that in December of last year.
I think there was a lot of delays that probably weren't necessary. I mean, we went through, I think, 2 or 3 State of the City addresses where we talked about we were going to do something, and then nothing happened that year.
Now we wait for March 17th to see if the recall moves forward, and if so, if it ends up like the last one where Gray Davis was ousted and another moderate Republican, Arnold Schwarzenegger, was elected. John Carroll, KPBS News.
It's hard to find a positive side effect of the pandemic, but this year's flu season might be one. It's been very mild with sharp declines in cases and in deaths. KPBS reporter Matt Hoffman says much of the credit goes to steps taken to prevent the spread of COVID-19.
You know, I've been here for 21 years now. I have never seen it this low. I don't believe I've ever had a year where there was no death by this time.
Kaiser San Diego Assistant Medical Director Dr. William Sang says an extremely mild flu season has been a bright spot during a deadly pandemic.
We knew the combination of flu and COVID would be a killer.
From last July through the middle of January, just 662 confirmed cases of the flu have been reported in San Diego County with no deaths. During this same time last year, there were 10,000 cases and 32 deaths.
I've never seen it like this.
And Dr. Sang says while initial symptoms are similar, for hospitals, there's no confusing coronavirus cases with flu ones.
From the test perspective, there's absolutely no argument. It's completely different.
He says at Kaiser San Diego, when patients are having respiratory problems, they're given tests for both the flu and coronavirus.
We have seen that even if they're positive for COVID, they're negative for the influenza.
The CDC says influenza activity nationwide is unusually low, and health officials say that's because the same measures used to contain coronavirus, staying isolated, wearing masks, and social distancing, will also curb the flu.
We're doing this to protect people from COVID, but the side effect of that, or the benefit of that, is we also drop down any type of transmissible disease.
Dr. Sang says protective measures are extra important right now with a new, more contagious variant of the coronavirus in San Diego. Locally, Kaiser is still working to vaccinate its healthcare workers and senior patients.
As soon as we get the supply, we get it in arms. And we start with the population that's most at risk. And as soon as we finish that and have the supply availability, then we move down to the next tiers.
With fears of a twindemic, health officials have been pushing for months for everyone 6 months and over to get their flu vaccination. Matt Hoffman, KPBS News.
A couple of bright spots for our local tourist attractions, starting with the Midway Museum. Usually the decommissioned aircraft carrier gets more than 1 million visitors per year. As you can expect, that number took a hit in 2020 with only 350,000 guests. After a recent closure, it's now back open for visitors. For now, only outdoor areas like the flight deck are open for tours, which have to be reserved online.
I think a lot of people are really anxious to get out of the house and go out and do things, but they want to do things that are safe. And Midway really presents itself as a safe experience for everybody in San Diego.
Midway Museum volunteers, many of them retired military members, are taking extra care cleaning high-touch areas. Many of them are in their 70s and have already received the vaccine. SeaWorld is also reopening. Gates will open this weekend for the first time in a couple of months. The theme park will operate on a reduced schedule, just Friday, Saturday, and Sunday for now. It will also be open President's Day next Monday. Rides will be off limits and reservations are required. February is Black History Month, and like so many cultural events, organizers are taking their programs online. That includes a special exhibit by the San Diego History Center. KPBS arts reporter Beth Accomando gives us a look.
There's a saying that a picture's worth 1,000 words. San Diego History Center has photos that speak volumes about African Americans in San Diego throughout the decades. Take these portraits from the 1890s, described as woman with a parasol and man with a derby hat. Marketing manager Shelby Gordon says she's been thinking about the people in these photos and what those images can tell us.
People think that blacks coming to San Diego early were not subject to segregation and racism, thinking that California was more progressive. That's not necessarily true. So what I see in those photos is perseverance, that in spite of, in view of the fact, you still gotta find man who has enough respect for himself and his reputation and that of his family, that he wears the finest derby hat he can, and then pays a photographer to take a picture of him in it.
A diverse array of photos make up the bulk of San Diego History Center's new exhibit, Celebrate San Diego, Black History and Heritage.
I'm a Black San Diegan, so a lot of these are snapshots of my life. I was baptized in a pool like this. I know ladies who lunch in that photograph. They dressed up, they ate outside, they had beautiful tablecloths, and I'm really glad that we have these kinds of photos to remember that.
Many of these are from the Norman Baynard photo collection.
Mr. Baynard, who was a black portrait and events photographer here for decades. His son literally brought us negatives and prints from his collection, which is extensive.
A collection housed in the archives at Balboa Park.
We are in the research archives. We are below the floor, below the exhibition space, and this is sacred ground. There are newspapers and microfiche and negatives and prints.
The Black Archives collection also contains documents and ephemera, ranging from the Spanish colonial census of 1798 to the Black newspaper, The Lighthouse.
They talk about things that are still relevant now. Coming out to vote about Central High School, even though that happened in Little Rock, Arkansas, it was a significant milestone and race relations, and that is depicted on the front page of the San Diego Lighthouse.
There are also items that have been donated.
This is a book from Bethel AME Church, and that's African Methodist Episcopalian. This was their commemorative book for their 100th anniversary. And again, for us to be able to have this here is a real feat, because that right there is a capsule. That's a time capsule. And then last year, Jackie Thompson, who was an Olympic athlete, actually went to Morris High School, ran with Mickey's Missiles, and she donated her Olympic competitor number to us here at the center.
But there are gaps in the Black history the center has gathered.
And we said, then what a great idea then to go to the community so that they can insert their memories, their reflections, their milestones, their photographs, their art to be inserted into our virtual timeline.
A virtual timeline gathering all these materials can be found at the San Diego History Center website, where people can look through images that tell amazing stories. Beth Accomando, KPBS News.
You can find all of our content on the Tracking COVID-19 page at kpbs.org. In addition to our reporter stories, we are updating our live blog with the latest news and case numbers. We also have some new features in recent days, including the vaccination dashboard we told you about a little earlier, with a map to find your closest vaccination site. And that's all for this special edition of KPBS News. I'm Maya Trabulsi, and for all of us here at KPBS, thanks for joining us, and stay safe.